Welcome back to Therani, I'm Joe B. Today I'll show you how to improve hip flexion for better leg swing during walking. Let's dive in. Posterior hip glide occurs more frequently during the swing phase of gait. Reduced posterior hip glide can be due to a hip flexor weakness or an L2 nerve root irritation. This results to hip flexion and internal rotation limitation of motion, stiffness feeling during negotiation of steps, curbs, ramps, and inadequate hip flexion during swing phase of gait. The assessment and joint mobilization treatment for reduced hip posterior glide is the same. First, observe the patient's gait laterally and compare it to the other side. As during initial swing phase of gait, there is a 15-degree hip flexion which progresses to 25 degrees during the mid and terminal swing phases, carrying over to initial contact and loading response. During foot clearance and placement, hip range of motion goes up to 60 degrees, same with running. After that, position the patient in supine with the tested hip close to the edge of the table. The therapist should be on the tested side with hands clasped on the proximal anterior thigh. Patient's back of the knee is resting on the therapist's shoulder. The therapist passively flexes the hip to allowable range of motion, and with the clasped hands, the therapist bows to dig the ulnar border of the hands while leaning backward in order to cause a posterior-inferior hip glide. Motion is then compared to the opposite side to determine hypo or hypermobility. If with noticeable limitation, the technique can be held for 3 reps for 30 seconds each. If your patient has significant limitation of motion during assessment, a long axis traction can be utilized by having the patient be in supine with a treated hip close to the edge of the table. The therapist will be on the tested side with hands placed above the malleoli. From there, the hip is flexed and abducted 20 degrees with slight lateral rotation to assume the resting position of the hip. From there, the therapist pulls the leg by leaning backwards to move the hip at the limit of the range, and even a high velocity, low amplitude thrust can be delivered through a quick tug, which is grade 5. Once the mobilization techniques were provided, patient can be given hip flexion and internal rotation active range of motion exercises for home to retain motion. If you like this video, please like, share, and comment. And for more therapy animations, please subscribe to Therani.